Chapter 5, Environmental Emergencies. This chapter has a lot of useful information in it, but for this class, we're just going to go over the ones that you will find yourself more likely to encounter in your times as a caregiver. First up, let's talk about animal bites. First, we need to stop the bleeding by applying direct pressure over the wound. If the wound is shallow, wash inside and around with soap and running water. Then flush the inside with clean running water. Cover the wound with a thin layer of an over-the-counter antibiotic ointment and a sterile dressing. If the bite is severe, it should be cleaned at a medical facility, and so get to a medical facility immediately. When taking care of somebody with a wild animal bite, here are some things you should not do. Do not try to capture the animal. Do not kill the animal. If you must kill it, do not hit or shoot its head. Preserve the head for medical exam. Also, contact the local health department to report the situation. Next up, spider bites. First, clean with soap and water. Then, apply an ice pack to the affected area. 3, seek medical care. And 4, if it was a tarantula spider, can flick their hairs, remove the hairs with sticky tape, wash with soap and water, and apply a hydrocortisone cream. Next up, insect stings. First, immediately scrape the stinger and venom sac off the skin with a fingernail or plastic card, such as a credit card or rewards gift card, or brush it off with your hand. Do not squeeze the venom sac. Wash the area with soap and water. Apply an ice pack for up to 20 minutes, placing a paper towel or thin damp cloth between the skin and the ice pack. Then give pain medication. Lastly, apply hydrocortisone cream and give an antihistamine to relieve itching and swelling. Now, when dealing with insect stings, if the person is allergic to the insect or has signs of a severe allergic reaction within 30 minutes, make sure to call 911, help the person self-administer an epinephrine pin, also known as an EpiPen. 3, monitor breathing, and if it stops, perform CPR. And lastly, for a sting in the throat or mouth that causes swelling, have the person suck on ice or flush with cold water. And in all cases of allergic reactions, immediately get to a hospital to receive further care. Next up, spider bites. First, clean with soap and water. Then apply an ice pack to the affected area. 3, seek medical care. And 4, if it was a tarantula spider, can flick their hairs, remove the hairs with sticky tape, wash with soap and water, and apply a hydrocortisone cream. To remove a tick, use the following procedures. Use tweezers or one of those specialized tick removal tools to grasp the tick as close to the skin as possible. Pull upwards with steady, even pressure. Do not twist or jerk the tick. Make sure to lift the tick to the tint of the skin. Hold in this position until the tick lets go, approximately 1 minute. Then pull the tick away from the skin. Make sure to try not to pull hard enough that it breaks the tick apart. The following is a list of ineffective methods to remove a tick. Applying petroleum jelly, fingernail polish, rubbing alcohol or gasoline, touching with a blown out hot match, needle, or paper clip. Make sure to not to grab a tick at the rear of its body. Once you have removed the tick, make sure to wash your hands and the area with soap and water. Apply rubbing alcohol to further disinfect the area. Then apply an ice pack to reduce pain. Next, apply calamine lotion to relieve itching. Then submerge the tick in alcohol, place in a sealed bag with its contents labeled and dated, and keep it in a refrigerator for 1 month to show a physician should a rash, fever, or flu-like symptoms develop. Lastly, if a rash, fever, or flu-like symptoms occur in 3 to 30 days after the tick's removal, seek medical care immediately. If at any point the tick breaks in half and the mouth part is remaining in the skin, remove the parts with tweezers, and if unable to remove the parts easily, leave them alone and let the skin heal. If an infection occurs, make sure to seek a medical assistance immediately. What to do for someone who's suffering from heat cramps. Have the person rest in a cool area. Give lightly salted cool water or a commercial sports drink. Do not give salt tablets. And help to gently stretch the muscle. Heat exhaustion. Here's what to do. First, move the person to a cool place. Remove excessive clothing. Next, spray or douse cold water on the person's skin and vigorously fan them. If the person is able to swallow, give a commercial sports drink, fruit juice, or lightly salted water. If none of these options are available, give cold water. And call 911 if improvement does not occur within 30 minutes. What to do when someone is suffering a heat stroke. 1. Move the person to a cool, shaded area. 2. Remove clothing down to the person's underwear. 3. Cool the person quickly by any means possible. The following methods are given in the order of effectiveness. Whole body cold water immersion, such as immersing someone in a bathtub. Evaporating cooling, placing ice packs against the armpits, groin, and neck area. Make sure to monitor the person frequently and call 911 as soon as possible. One thing I would like to point out is the difference between a heat stroke and heat exhaustion. When a person is experiencing a heat stroke, they will have an altered mental status, such as confusion or disorientation. If signs of these things are occurring, then you would want to treat this as a heat stroke and not heat exhaustion. If you determine a person is suffering from mild hypothermia, here are the steps you should take. Remove wet clothing only when in a warm shelter, prevent heat loss, add insulation, and cover with a vapor barrier. Apply heat to chest, armpits, and back. Use large electrical pads, electrical blankets, or warm water bottles. Place insulation between the skin and heat source to prevent burning of the skin. Lastly, give warm, sugary drinks to support shivering. Make sure to monitor the person so that they don't go into severe hypothermia and call 911 as soon as possible. And then severe hypothermia. When handling someone with this condition, make sure to handle the person very gently. Keep them in a flat, horizontal position. Prevent heat loss. Monitor breathing, and if it stops, perform CPR. Make sure to call 911. Provide rewarming if possible.